So, after 8 years of trying to get help, I'm not going to get it. My doctors are trying to finish me off instead. They're malpracticing on purpose, and every time I go to the doctors with black urine, bloody testicles, they just have me work and fall down, or try to go to the hospital by walking 8 miles, or they release me at 9:30 to walk home and I get hurt, or cars run me over, or just no good. Like the most recent one is I was told I'm no longer allowed to pass on information to my doctor at all. Even though they've been saying that in the beginning. Now this is the way it's done. They say I have to every patient has to pass on information with the secretary. And then she will try to remember it and play phone tag or the phone game with the doctor. Now I've been doing this for 8 years, and they can't even get a do not lift order right, or a out of work order, or any of my injuries documented, or any of the stuff that everybody's seeing on paper. They're not doing any of that. Now I am in such bad condition that I'm about to lose everything. I'm gonna end up trying to see the doctor from living in a tent in the woods again. So I'm gonna have to live with my disabilities in the woods again, getting hurt because my disabilities have been for 25 years. I grew up with them at age 5, 6, 7, 8, but my mother tried to cover them up. So I'm forced to live like an animal in the woods. I just got out of the woods about 10 years ago. I was living in there from 19 to 23. I had multiple shacks built. I tried the shelters, but they would just abuse me because I didn't have documentation of my disability. So sometimes they would kick me. Sometimes I would be raped. Sometimes it would just be awful. I was even raped on camera in Lowell Treatment Center, and this was literally right then and there. They even tried to get me to sign a release that I wouldn't sue them, and that way I couldn't sue them because it was caught on camera that they allowed this guy to rape me over and over and over. Now all they did, it was a psycho kid that kept on coming to my room, getting in bed and sticking his finger up my bum. But he was 8 rooms down, and the staff members were aware of this and allowed it. And so when they got caught, they were afraid of a lawsuit. But what they didn't know is my family doesn't care. They don't care if I lose out on a lawsuit. They don't care if I get injured. They don't care if I get raped. They never did. I call them and try to tell them these things go on. Oh, we're on vacation. We're having too much fun. We're in Florida. Get raped some more. Have fun. Bye bye. Stuff like that. So you got crazy hospital people coming into your room doing that shit. It's wrong. It's wrong. That's why I had to literally almost choke the kid. I had to grab him, throw him across the room, and then I had to be like, do not let this kid in my room again, or I'm going to kill him. And I didn't. I was always polite and very nice about it because I know he's mentally ill. But this is what's going on. I had shit happen to me. Now my kidneys are shutting down. My GI is swollen. I'm peeing black. Last year I was bleeding internally into my testicles. I've had multiple head injuries. I got scars all over my face. I've looked like Freddy Krueger slash uh, Frankenstein during my last seizure. I've shooken for 25 years. I haven't been able to write or keep my hand steady for 25 years. I ended up getting food poisoning multiple times. I ended up getting poisoned by medication by my mother giving me overdoses on purpose. She started giving me epicac punishments, beating me with rulers, affecting my mental health, twisting me, trying to convince me I'm. So, for one, I'm not schizophrenic, and I've never been. Thank God that no doctor has ever thought I was schizophrenic. It's never been on my record, and I've never taken, well, I have been on a schizophrenic medication because my mother just pushed for it. But it was no reason. The doctor got very angry. And that was at like age 7. But, anyways, so there was no reason for this. But my mother used to try to scream at me and smack me around saying that I need to be convinced that I'm schizophrenic. I'm playing with action figures, so I must be schizophrenic. It was what she was telling. And then when I told her, no, my roommate across the hall is schizophrenic. He hears voices. I know what it looks like. That's not me. Doctors say it's not me. Everybody, the teachers, everybody says that's not me. Then she gets very violent and angry, starts slapping me around and telling me that I need to be schizophrenic. So this went on for many, many years until she committed suicide with pills and alcohol because the guilt got her. Also, teachers and family members came up and tried to intervene, but my father wouldn't allow it, and my mother wasn't going to allow it. So now I'm forced to just die in the woods and live in the woods with injuries. I finally worked my way up to an apartment in New Hampshire. I've been asking for help for 8 years, and I kept the economy going during COVID. I'm not on any welfare. I'm not on Social Security. I don't get any cash benefits. for the last 8 years, I've injured myself and kept commerce going. When every gas station shut down, every single bus shut down, all taxis shut down, every single store and every single thing in this town shut down, but grocery stores, gas stations, even the doctor's office limited their hours. Hospitals were still open, but they lost half their staff. But yet, I was forced to work while injured because my doctor didn't want to give me a do not work order. So I literally also caught COVID. I had all the flu symptoms. I had every single symptom of COVID, and they lasted for over a month. But because my doctors would not see me or treat me, I was forced to work with COVID, with pre-existing conditions, falling down on the side of the road. And now I'm most likely going to lose my apartment. All because I have no documentation of my injuries. I cannot walk anymore. I cannot move. So I'm going to try to hitchhike a ride if I lose my apartment. If I lose my apartment, this is my plan. There's no way I'm getting medical care up here. If I spent 8 years and over thousands and thousands of hours in the emergency room and doctors working with 5 different specialists, and they can't even provide a single piece of paper that a regular doctor knows how to fill out, or if they can't provide at least a cane while somebody's crawling around bleeding on the ground, then when I lose my apartment, there's no way these people are going to take my disabilities into account. They're literally going to hurt me so bad that I'll never recover. There's no way I'll ever recover. I'll be raped, beaten, I'll freeze to death. They're going to scrape me off the road again, frozen with body temperature in the 70s. I'm going to get further head injuries. My arms won't work anymore. My legs won't work. Who knows what color my body parts turn? Seeing as I've had my balls fill up with blood and I've had my urine turn black. My kidneys have pumped out. I've seized and I've seen blood come out of places where they're not supposed to come. Like, for instance, I bled out of my eyeballs one time. I had a head injury after one of these shakes. Actually, somebody hit me, but that didn't cause the injury. I ended up shaking for the night from the cold, and then I went into an ATM after falling, and then I went to sleep behind it to try to hide. But within about an hour, an officer said he was arresting me, put me in cuffs, but he said it was my lucky night because blood was dripping down my eyeballs. I said, what do you mean? He goes, there's blood coming out of your eyes. So I said, no, there isn't. So he pulled out his phone, took a video and showed it to me. Yep, there was blood coming out of my eyeballs. But no, this is not concerning. I went to the hospital. They did absolutely nothing for me and then released me in the morning because I was a homeless individual. And then I went back to the woods to live with my disabilities. And if you're wondering how could this happen to somebody, this is what happens when you purposely cripple a kid, disable them, try to avoid responsibility, traffic them from state to state, and then you end up just committing suicide and throwing them to the dogs to live in the woods. Now, don't think I didn't try shelters either, but shelters don't work if you don't have documentation of your disabilities. If you're in a wheelchair and need a wheelchair, but you happen to be sitting in a chair and you have no documentation that your legs don't work, they're going to get very upset at you. And that's just somebody else. My legs do work. Just that during my seizure activity or that I fall down, I only can stay for 2 minutes. It just doesn't. It's mostly when there's other stuff going on. Like right now, I talked about the black urine, the kidneys failing, the GI. That's putting pressure on my nervous system. So if I get up and try to walk, I won't be able to talk. I won't be able to move. And after 2 minutes, I will get hurt. So I don't do that right now. And if I do heal the GI or if the kidney swelling goes down, I still have the pre-existing conditions. I still have the stomach issues. I still have over 25 years of one thing, 20 years of another thing, 15 years of another thing. So I have a lot of pre-existing conditions that I'm waiting for doctors to please pay attention. I mean, they can see it. I've been bloody so many times. Oh my God, my head looks like a cutting board. But anyways, if they throw me out, I'm going to have to take this. That's my meds. That's my med box. That's my filing cabinet. This is my wheelchair. I can't lift this though. That's the problem. I can't lift this. Luckily, I had help loading it. So that is my sleeping area. That's a padded waterproof blanket. Those are tarps so I can bury this when I get to Florida. Now my plan, if they try to kill me and they try to finish me off and I'm in the woods and I'm just sitting on this box near the road or something like that and I have no way of lifting this. So literally I'm going to have somebody just drop this off on the side of the road and then I'm stuck with it. And that's it. But I have to come up with some plan to stay alive, and if I stay up here, I will die. I will. They're finishing me off. If they can't help me in an apartment, if I go to the shelter, I'll be dead in a month. They're going to get me so fucking hurt. I won't be able to talk by the month. And then they're going to say I'm a stupid guy who can't talk, and they're going to really treat me poorly. They're going to start really fucking with me. Oh my God, screwing with my meds again, stealing my meds, letting other people beat me and rape me and do things. Just terrible. Just terrible. And don't forget, they're going to mess with my disabilities too. I can't write proper, and I shake so much, but how much you want to bet they're going to use that against me? So this is the plan if I get stuck in that situation. First of all, I need to hitchhike and freeze and have seizures in the back of a truck. So we'll do that. We'll have somebody help me load this. I'll explain to them I'm injured and I have a doctor in Florida I need to go see. Okay, so they load this up and I have them drop me off someplace random in Florida. Now here's the thing. I will be getting care really easily if I don't use my name. I could get medical care perfect like anybody else. But see, my mother screwed up my name to the point where as soon as I give my name, the doctors start malpracticing me. Like, for instance, I gave my name for a new patient appointment. Okay? I told them I needed an experienced doctor who's older because I have pre-existing conditions that are stacking up and have gone undocumented. They told me everybody's experienced. So I said, well, older doctor, somebody who has more experience with difficult cases. They gave me the youngest doctor who's about to go on medical leave, who has little to zero experience in cases like mine. They did that on purpose because they saw my name. They typed my name in, they saw that I was a psych case mostly, and so they just did the opposite of what I asked. This is the care I get. That's why I gotta go down to Florida, forget my name, and burn off my fingerprints. I literally gotta burn off anything that has to do with my identity. Literally, and then just forget my name. They'll see how much blood is in my area. They'll see how much swelling there is. They'll see the black urine, and there's no doctor that wouldn't be concerned seeing this. But I just have to make sure that I lose my identity for at least 30 days so it gives the doctors time to actually do their jobs. Because as soon these doctors just keep on malpracticing me. They see, I mean, they can see black urine, they can see blood, they can see in pain, but they choose not to. They choose to play games. They choose not to listen to the patient, and they do the opposite. I say, this is going to get me hurt, so please don't do that. I need this. And then they do exactly what I said would get me hurt. I say if you use any of my old documents or any of my old records from before 2011, that most likely will get me hurt. And that's all they'll use then. I ask for an older doctor with experience. They give me the youngest doctor with the least amount of experience who's about to go on medical leave, or I should say maternity leave. Don't forget that I keep on getting phone calls that they're on vacation, their kid they had to pick up. Meanwhile, I'm bleeding in hospitals. This is the care I receive, so now I gotta burn off my finger. Well, first we'll see if they actually help me. I have maybe 30 days to 90 days before I have to be outside living in this box here. That my roommate said, hey, maybe they can bury you in it. Because he knows how bad I really am, and he's the one who packed it. But we said maybe this could be a good burial box for me. Because I do want to be buried with nature out in the woods, so if I get a friend, maybe they could bring me out. I don't know. I get too depressed looking at this, trying to fill out my last will and testament at 31, all because nobody wants to do their jobs. I just get too upset because there's no reason for this other than people's neglect and people's assholery. I mean, you can't write a piece of paper? What do you mean you can't write a piece of paper? Oh, there's nothing you can do about people who can't walk? Oh, I didn't know that. I thought that when people get hurt and have trouble walking, that there was something that doctors could do about that. I didn't realize that there was nothing you can do if you break your leg. I didn't realize that if you have a neurological disorder or you get paralyzed, that there's nothing doctors can do. Oh, wait a minute, there is something they can do. They just can't do anything if they're on vacation bullshitting around. That's the problem. If they just spent the time looking into this or listening to their patients, then it wouldn't be a problem. But I hear this all the time from patients who are suffering greatly. I mean, just look at Dr. Death. He was allowed to practice and hurt more patients after it was already aware that he was hurting patients. Now, I am a hurt patient who's suffered greatly, who wants help, and it's not that hard. Yet, I'm going to have to burn off my fingerprints most likely, bring this box to Florida, get them to help me, and then come up and give these motherfuckers a piece of my mind to doing this to a disabled man for 25 years, treating him and making him more disabled. My mother weaponized doctors and medicines, and these doctors are still in weapon mode. They need to stop. She passed away in 2011 of suicide. We don't need to continue her abuse. But yet the doctors continue hurting me and weaponizing and hurting me until I'm so fucking on the ground bleeding, and they're like, hey, how did this happen? How did Zach end up bleeding on the ground with scars and not able to walk? I don't know. I do, because I told you this would happen. You didn't listen. You did the opposite of what I told you to do. You didn't write me any medical paperwork. You didn't give me any do not lift orders. And now I'm bleeding at the ground. Now an ambulance is picking me up. And now I'm pissing black. Now there's blood in my testicles. Now my kidneys don't work. Now my intestines popping out. And this is all happening in this exact moment, to the point I can't walk. I literally have this right here, but even if I use that, I only get 2 to 3 minutes. I have to go over there to here. I have to sit on there to go to the bathroom. I even have another chair right there. I have to go from chair to chair, and I still don't make it. I still fall just from going 5 feet. When I try to go downstairs, same thing. So yeah, I'm going to have to see what happens for the next couple months. Hope that people do the right thing. Keep praying to my Lord. Please keep on praying to God. Keep on being a good person. Keep on doing everything I can to help others. Try to do all the right things. Go to the doctors. Don't do drugs. I'm doing all the right stuff. It's just the doctors are not doing the right stuff. That's for sure. I've already had talks with other doctors online, and they say my doctors are acting seriously inappropriately. They tell me to get an attorney and record what they're doing. And I do. I have proof of every single statement I have made talking to this. It is so ridiculous. Like the fact that they tell me I can't leave messages with my doctor, like my urine turned black, and I just want to let them know, hey, I'm going to the emergency room because my urine turned black. I have a sample, I have a video, I have all that. Oh, sorry, we can't pass that on. We can't give it to your doctor. No, I just wanted to leave a voicemail. That's what I mean. You can't leave a voicemail. Okay, can I leave a voicemail on your voicemail? No, sorry, you can't do that either. How do I get in? Do I call back? No. She won't answer. No voicemail, no answer. I don't call back. How am I supposed to do this? Well, you can just tell it to me. So I tell it to the receptionist. She plays a game, and then my doctor never gets it. They do this stuff on purpose so they can bill you and bill you and bill you, but then do absolutely nothing for you. She's billed me for a year. They even triple billed me for the same CT scan. I had to go back and crawl on my hands and knees 3 times. So this is why I have this bag here. I'm going to need somebody else to bring it down a flight of stairs for me. Then I'm going to have to be out in the cold, shaking, waiting for some truck to hitchhike me all the way to Florida. Then I got to burn off my fingerprints. I got to remember to forget my name. I got to wait for I'll probably have a seizure on the way down and multiple head injuries, so I'll probably be all bloody by the time I get down there. So I'll just use that. Just say I'm all bloody and I don't remember what's going on. Even though that would be a lie and I can't lie. So I'll have to try to dodge the question truthfully, which is very difficult. But if I give them my name, I'll be malpracticed right from the get-go. But if I don't give them my name, they'll finally run the x-rays, they'll finally run the exams, they'll test the black urine, they'll see the black urine coming out of my you-know-what, they'll see everything of all the shaking, the seizures. It's not like I can hide it. I try for 5 minutes in front of customers, but it doesn't work. I can't even hide it long enough for customers not to see me shake or fall. In the last year of this job, I have fallen twice in front of customers in a serious way where they wanted to call an ambulance, and I've shook plenty. And somehow I managed, while injured, to get more work and be a better employee than most of the hirees I've had. I've had customers make a point to tell me that, managers make a point to tell me that, and they want me to become assistant manager or give me raises. Well, that's kind of because I actually do my job to the best of my ability, and I like working because I was never really meant to work. I was always like a Social Security, made disabled, I was made a GIMP, this, that, work the school program here, no normal life, no normal car, and I've had to wait 15 years to drive. I can drive, by the way. I just have to take an Ativan and a little shot, and then my nerves are settled enough. Or I can get epilepsy medication with Ativan, and then I can drive as well. But I need to have a diagnosis first, be a year without seizures or shakes, and then I can just drive. But because these doctors keep on playing games, I've had to wait 15 years to drive. 15 years I've been waiting for somebody to treat my shaking so I can drive. But they still play games. I still have no documentation. 15 years waiting to drive. So I have to literally just walk hundreds of miles sometimes, fall down, camp in the woods. It's terrible. And now I'm going to have to do it all over again. All because these doctors don't want. I mean, I've done plenty in the last 8 years. There's no reason for this to have to go on other than neglect.